functional rehabilitation, chiropractic, functional medicine for different metabolic issues, all around health practitioners. Today, we're going to talk about tech neck, tension, and tight traps. So, what is upper cross syndrome? And what it might be doing to you.
Yeah.
So, first of all, let's talk about what is upper cross syndrome.
Yeah, I feel like a lot of people kind of know about it, but they don't really know that it has a name.
Sure.
Yeah.
Technical definition of
Right,
it.
right.
I think a lot of people have heard of the tech neck
Right.
nowadays.
Yeah, no, I think so.
Definitely got through the news cycles a couple of times
Yeah.
over. In the comments, if you know or have heard about tech neck or some other version of this scenario, go ahead and throw it down in the comments.
Well, it's so prevalent now. It really
sure.
is, right? Because everything that we do, like it's on the phone, right? It's on the tablet, it's on the computer. That's how we live our life, which, by the way, I wouldn't change for anything. It's how my life works. But at the same time, pros and cons, right?
For sure. I think definitely a larger section of the community is exposed to computers and cell phones and things than maybe 20 or 30 years ago.
Mm-hmm. And kids nowadays as well. Like it used not to be as prevalent in children, but as we're aware, children, they do a lot of learning on computers and iPads, which is, I think that it has really gained some advantages in so many ways. But at the same time, like your head's also like this.
Seeing a lot more younger people with this tech neck scenario. I guess our generation, we didn't have cell phones, tablets, or anything. Like the closest I was going to get to be drawn in a book or something. But more and more of the kids, the first generation that had access to cell phones or smartphones, they're starting to grow up, and we're seeing more and more of those suffering significantly with that anterior head carriage or upper cross syndrome. So definitely more prevalent nowadays than it used to be. Or if you look at the textbooks, most of the textbooks are 30 or 40 years behind. Normally, we wouldn't see a 20-year-old with an anterior head carriage with a complete loss of curve or anything like that.
Oh, for sure.
So it's definitely going to rewrite some of the degeneration cycle patterns. So normally we wouldn't have seen a complete loss of curve or reversal of the curve until somebody had at least 20 years worth of damage to their neck.
Yeah.
Now we're seeing it in 5 to 10 years.
Right, because especially like once you injure your neck or your back or something like that, previously what would happen is you would injure it, but then you would go back to your daily life, right? Which was up here. But now you go back to your daily life, and this includes children as well, right? With all the bumps, falls, slips, rollerblading accidents, or whatever. And they go back to this right here. And so this is how they're healing.
For sure. So definitely more common than it used to be. So definition. Let's go with the definition. So upper cross syndrome is going to be an imbalance of a postural imbalance of muscles. So we'll have some muscles that are too tight, and we'll have some muscles that are weakened or not facilitated anymore. So over facilitated and under facilitated. So we're going to have two categories of muscles. Generally, we're going to, for the upper cross syndrome, we're thinking basically mid back all the way to the top of the head. All the muscles that we're going to be categorizing are going to be in that area. We're going to see a position change like this. So the head's going to come forward, the shoulders are going to roll forward, and the upper back's going to come backwards. And so this is typically what we're going to see of an upper cross patient. So somebody that's suffering from that. Sometimes it's not quite as severe, maybe just the head forward. The shoulders haven't fallen forward, or somebody that has a relatively straight neck, but the shoulders have fallen forward quite a bit.
You always do that so well.
So we get lots of different versions of the upper cross syndrome, but the basic muscle groups are all going to be the same. The first thing that we're going to see is that the anterior neck flexors, so ones deep behind our Adam's apple or our throat, those are going to become weak. Normally, those are the muscles that hold our head up in a normal arc. And those are the muscles that keep everything going. So as a head goes forward, those muscles become disused. So they just don't work anymore because your head's come forward and they can't do anything to keep your head up. In response, we're going to see an over-acceleration of the traps over there. So these big muscles up here in our shoulders, because those are suddenly the only muscles that can keep our head from falling forward. Now, those big muscles, traps and levators, if I went to the gym and I wanted to train those muscles, I would do some overhead presses. I would do some shoulder shrugs. I would do things to move my shoulders, not move my head. So they're not designed to hold our head up very well. They don't enjoy it very much. So they get overstimulated. They start to develop things called trigger points. So those really tender nodules in the muscles, they stay stiff all the time. They never turn off. Like
It's whenever you go get a massage and they start digging into your traps and you like want to cry.
You get that burning, searing pain that radiates somewhere else. Those are trigger points. Trigger points come from an overused muscle. Very, very painful, but they're a good indicator that you probably have something like upper cross syndrome.
Yeah.
So the traps and elevators become overused, doing a job that they're not designed to do. Really stiff, really tight all the time. And so that's where all that upper back tightness is going to come from, that head forward like this. The next thing that we're going to see is that the pecs are going to start to tighten up. And as our head goes forward, all the attachment points for the muscles that support our shoulder come from our neck. Now the angle goes forward, changes it. The shoulders are going to follow. To stabilize, our body's going to tighten up the pec minor and the pec major. We're going to see all that roll forward like this. In turn, we're going to see a weakening of the muscles between the shoulder blades. They're called the rhomboids. They're small retractor muscles that keep our shoulder blades back and down. So as those get stretched out, they become underused or underfacilitated. So those are the four big muscle groups. There's more intrinsic and smaller muscles that are involved in the scenario, but that's the general idea of what upper cross syndrome is. We definitely see it.
It's basically like the front and back are competing constantly. And whenever the front up here is too tight and this is too weak, it comes forward. The front starts winning.
For sure.
Yeah.
Right. It's almost a flip of the muscle's natural job.
Yeah.
So all of a sudden, the normal job that they did, no more. It's doing this new job. And so it's really bad at doing its old job and really poor at doing its new job. So everything just gets out of whack. We lose a lot of function. We lose stamina and how long we can sit, we can stand, we can do those kinds of things. And so that's where we start to see some problems. Got a question. Can you correct a hunchback? There's different types of hunchbacks for sure.
Right.
A new hunchback, so something that relatively new that's just going to be a muscular based one. So it's all in the muscles and just positioning. For sure, you can change that.
And it depends on if like there's a scoliosis involved, right? If it goes sideways, it also depends on how long it's been going on. There's several different factors in that.
For sure. So if it's just muscles, it's relatively new. You're young. We don't have any degeneration. We don't have any broken bones. We don't have any misshapen bones. We don't have any fusion of bones. You can change it.
Right.
Now, if you have some broken bones or you had some osteopenia, so we'll see that in older females, we'll have some osteopenia and the bones will actually collapse to the front. You're not fixing that.
Right.
You can make it feel better, but you're not fixing that.
So like Dr. B, right? He broke his back in football and he actually has collapsed vertebrae.
Three of them.
Yeah. And so like in that scenario, can't unbreak a bone.
Right. So definitely there. Let's see. Now, upper cross syndrome, I guess we can talk about the normal causes. And just go back into that.
Yeah.
So we were alluding to it in the beginning, and that we're talking about cell phones and forward head carriage and different positions that get us stuck this way.
So obviously, one of them we just talked about injuries, right?
Yeah.
If you have injuries, like that can definitely be a factor to what's going on. Some of those, if you get to them early, you can have a huge impact. So Dr. B, right? Whenever he had his whenever he broke his back, he immediately went to the chiropractor and started doing some treatment. And so that really saved him in all reality. But because of that, he still has a little bit of a curve, right? You can only change so much, but what it would have been massively different.
Right. The chiropractic helps the discomfort from it. So it definitely keeps the mobility in that area for me. But it doesn't do the trick. So I have to maintain a lot of my normal muscle function. And I always got to keep a tab on it just because I have this big propensity to be in this really, like this is what will make the pressure go away the most. So if I just roll forward, it takes all the pressure off those bones that are the most affected. So I have to be very conscious at keeping all these muscles online and doing what they're supposed to do. So I'm always doing some form of what we call our true form system. So I'm always doing some physical therapy at the same time. So car accidents, slip and fall, sports injuries, getting hit in the head, all those things that affect our neck, whiplash things.
Football.
football for sure.
Such is life.
Your body's natural inclination is to offload the injury.
Yeah.
The vast majority of the injury is going to happen in the joints and the backside of our neck. So to offload, it's going to try and push everything forward. And so that's what push us into that upper cross syndrome.
It's just like an ankle if you sprain it, right? Like if you sprain your ankle, you're not going to want to walk on the ankle. You're going to want to walk on the other side. It's the same thing.
Yeah, same thing. And so this is where we get a lot of the persistent upper cross syndrome. And then you add some cell phones, some computer work for 8 hours a day to it. It just makes it much more severe than we would have seen in the past.
Right.
So occasionally we could see injuries from exercise or some people that are just really like pec dominant. So I'm always working out. I'm always getting my pecs good.
Right.
I always got really big. My pecs are really good, but I'm stuck like this. I have no range of motion. Everything's just rolled like this all the time. So a little bit of improper form with working out can definitely get us towards that point.
Yeah, especially if you already have issues going on. And then I like to call them the pretty muscles, right? Because that's what we work out, because we don't care about the other things, because we show up to work out the pretty muscles, right? And so if you're working out your chest and your biceps and your traps, right? So you're going to end up being like this. It just is what it is. They get big and they get beautiful, but on the other side of it, everything else is still not being taken care of. And we are now forming ourselves more and more like this. So we see a lot of gym people come in here.
Sam Sulek, he's a famous YouTuber and all that stuff.
Yeah.
You look at him and his pecs, he's got some really big pecs and delts, but he's really far forward.
Yeah.
Right, everything he's got, he's so bound up in the front, he can barely do lots of exercises and range of motion where his arms are back here. So.
Right. And being pretty is beautiful, and I'm all for it. But at the end of the day, like most people, they want to be able to like reach their arm up and like actually like wash their head. Like for most of us in the real world, like we want to be functional throughout our life, right? Like you want these things.
For sure. Speaking to the desk chairs.
Yeah.
In order for a desk chair to have a headrest that would be beneficial for you, it would have to be so upright, you would be incredibly uncomfortable. Most of the time, what we're going to say is what your body can maintain on its own is going to be where we're going to be the most beneficial. So a desk chair that keeps your rear in a good level and keeps just a little bit of support to the lower back, but keeps the rest of you very upright is going to be more beneficial than a chair that has a headrest in which you're working on a computer lean back like this.
Yeah. And I go completely opposite, because I'm all like, oh, let's work in a stool, like just a stool, so that you can move around as you're working, right, and kind of stretch out. Or obviously for some people, like a yoga ball, because I spend a lot of time on the computer as well. And so for me, what I really recommend is mobility, because whenever you get in the grind, whenever you like working for like hours, like whenever you have to get up every 20 or 30 minutes, that's hard. That kind of breaks your focus, right? But if you can stay mobile as you are working, I found that that just works so much better.
It certainly engages the right muscles to keep you in that upright place too.
Yes.
So, real quick, let's talk about some symptoms that the upper cross syndrome gets us. So a lot of people are going to get tension headaches from this. It puts a lot of stress and pressure at the base of the skull here. So we'll get discomfort, pain, headaches that start at the back of the skull here, sometimes radiate all the way to the front right here. So it's definitely one of the symptoms that we'll get.
So tell them about it, Dr. B. Every inch your head goes forward, it adds like 10 pounds.
10 pounds or a percentage, right? So it's actually a compounding. So like my head an inch forward, a whole lot more than 10 pounds compared to her.
Right, yeah.
I got a lot bigger weight up here. So every inch forward is definitely a compounding percentage of your head weight forward. Not good. A lot of stress and pressure on the base of the skull here. Obviously neck stiffness and tightness is going to be one of those symptoms.
And you can think about it like if you're holding something right here, no big deal, right? You can hold it kind of here all day. But whenever you stretch it out and try to hold that for 10 minutes, that is a very different thing.
Way different, yeah. One of the other things that we're going to get, other than just neck stiffness, is that as the head goes forward, we're going to get a lot of stress and pressure in the mid back as well. So this portion right here is going to start to be an anchor for a lot of those muscles. So we're going to get a ton of tension that goes all the way down even to the mid back. We'll see some pretty extreme hyperkyphosis. So the mid back, instead of being a nice smooth curve, we're going to see some pretty extreme compressions of it in the really bad upper cross syndromes. Definitely limited range of motions. The neck's not designed to work in its full range of motion in that anterior head carriage.
Yeah, no.
It's designed to work with that normal curve the way that
because
it's supposed
everything
to be.
gets locked out. Like the way that the vertebrae are designed, whenever it's stretched out like that, they're actually locked out.
Yeah.
So that inherently makes it to where you have less flexibility and less mobility.
One of the other things that we're going to see is a lot of decrease in mobility in the upper back as well as the shoulders. The shoulders are going to get in this very forward position. We'll get impingements, so lots of discomfort and pain with full range of motion through the shoulders.
Popping, clicking.
Yeah, for sure. It's going to cut off blood supply to the top muscle in your shoulders, so the supraspinatus is going to start to have some issues. We'll get some spontaneous supraspinatus tears or rotator cuff injuries, and so that's definitely going to be a factor for a lot of people that have those rounded shoulders right there. If you're working out and you feel a lot of popping and clicking in your shoulders, and it's just like every single time you raise your arm up over, and something's wrong with the mobility in the shoulder blade, which more than likely has a foundation in that upper cross syndrome.
And so much of your shoulder movement actually comes from your thoracic spine or your back.
Tremendous.
Once again, because everything gets locked down whenever you are in this position. And so try to bend forward, like give it a good go, and then try to move your arms, right? Like it's kind of goofy, but you can't do it, right?
Not gonna do it.
And so whenever you come up, your shoulders are actually in the right position, your scapula, your back, everything's in the right position so that you can move.
Get all that range of motion. Right?
Yeah.
The other thing that we're going to see, I remember in elementary school, they always told us to sit up and breathe to help us breathe so that our brain was more clear. We had less of the brain fog.
They told you that?
Oh, yeah.
Really?
Sure.
Oh,
they
I
was
missed
talking
that.
about how we had to be upright, right? The anterior chain becomes tight, which is going to reduce our lung volume capacity. So our resting lung volume is going to change just because we don't have as much room in the front for us to get that
100%.
breathing in and out. So we're going to breathe a little shallower. It's going to put a little bit more tension on our nervous system, so it's going to be more taxed in the scenario. So we'll definitely see more fatigue, a little bit more brain fog. I'm not going to say miraculously different if you don't sleep or something. You already got some fatigue, so way different. But throughout the day, if you're a little bit more upright, generally you find a little bit easier in order for you to get through your day, and that you have more of that oxygenation, blood flow, you have better scenarios, that you have less fatigue throughout the day. So those are the typical symptoms that we'll see with upper cross syndrome. Before we finish this one, we wanted to talk about a couple just simple solutions. So in our office, we go through a functional movement assessment. We actually figure out which muscles are most affected by the upper and lower cross syndrome. We can prioritize those muscles. We go through
because we kind of went over like generally what it's about, but everybody's just a little bit different.
Yeah.
Right. The same way, like his head's bigger than mine, right? Everybody is just a little bit different. And so you have to really do a functional evaluation to figure out like what's specific to you.
Yeah. Now, we have some generalities. So very, very common muscles that we're going to think of are the 4 that we talked about. Now, you may say to yourself, I just need to stretch my traps more. So simple. Right. Really easy to stretch your traps. You're just pulling your ear over your shoulder. Most stretches are most effective if done 3 times for 30 seconds. It's consecutive, so I'm going to do one side 30 seconds. I'm going to do the other side 30 seconds. I'm going to feel a burn in a muscle. I don't want to feel pain. I don't want to feel sharp pain. So if you do feel sharp discomfort or pain or radiating pain, stop. Go get that figured out. Yeah. But if I do something with my traps, but I don't do anything about the reason my traps are tight, they're just going to keep being tight. So it's not the answer to just stretch more.
Right.
So we have to work on the concurrent opposite muscle that's become weak. And so the pecs are definitely going to be an involvement with the tightness as well. So we're thinking traps and pecs are going to be our tightest muscles. Our weakest muscles are going to be our rhomboids and our deep cervical flexors.
Pecs are really easy to stretch. You can do this at home. You just find like a doorway, open it up, arm here, step forward,
pull backwards.
Easy peasy.
And generally, you want to try and keep the elbow in line with the shoulder. That's going to be a good starting point for most people. If you do feel some pinching, try a little bit lower or even a little bit higher. But move it around just a little bit to find the deepest, best stretch that you can feel through this forward position in your shoulder. So those are the two stretches that are really good. Now, if you're going to stretch, you got to do the exercise on the other side. The best exercise that's going to help with those deep cervical flexors is something we call a neck drawer, but it's a very basic exercise. You're going to want a firm surface, the floor, the headrest in your car. It's not going to work very well in your bed or on a couch or something like that. You need something that you can
use it against. Like I do it all the time in my car. Like whenever I'm driving, all the time.
I love doing it at traffic lights. That's my favorite. So, sitting at a traffic light, I'm like, oh, I got 30 seconds to a minute.
It's like your trigger.
Yeah. Now, simple. You're pushing your head backwards. So I'm going to push my head against whatever I'm going for. Now, a couple of the nuanced things that we want to make sure. I don't want to see the chin come up. So I'm not just letting everything fall backwards. Definitely not what I'm looking for. I don't want to see it all go up to the sky. So I'm not looking for my head to go way up. I'm looking for my neck to retract and go backwards. You're going to feel a ton of pressure through the front of the neck. You're going to feel some stretch through here. If you keep the chin level, sometimes you'll feel some stretch at the base of the neck. As long as it's not sharp or painful, good to go. Now,
be careful about the shoulders, because what you're going to want to do and what will happen. Yes, because you're going to be like, it happens every time. And then you're like, this isn't it. This is feeling weird. And that is how you know that you're doing it right. Guaranteed. If you're like, oh, this feels really weird, you're on the right path.
Generally, you're going to want to hold these types of exercises for a period of time. These aren't muscles of movement, so they're not like a big muscle here that you're going to just go up and down with. They're designed to hold a contraction for a long period of time. Slow twitch fibers. So you want to hold this for a period of time. Generally, we're going to do it for about 2 minutes in the office. Minimum of 60 seconds is what you're looking for. So you want that resistance against pressure for at least 60 seconds. Preferably 2 minutes. And you do that every time that you stretch. That's going to help you a ton.
But everybody's a little bit different. So kind of start where you start, recognize that, honor that, and then build your way up.
Sure. And then number 2 is going to be for those rhomboids or those muscles between your shoulder blades. It's a band. So you get a stretchy band from the gym or even order one online, super easy. So you just want an elastic band. I'm going to take it about shoulder width apart. I'm going to pull apart that band, and I'm going to pinch my shoulder blades together. Now, some details on this one. Now, if I'm pulling it apart, I don't want to see my shoulders jump up. Right? I don't want to see my elbows bent back and down. I want to feel a pinch between my shoulder blades. We call it a back pinch in the beginning. So we do some steps to get to this point just so we get the right muscles working. But I'm pulling across.
Because it's really harder than what you would think in order to like just really isolate those muscles when you haven't used them for so long. Like the path is not really there. And with this one, be real careful, shoulders, right? And also you want your head back, because you don't want like this. You don't want your head forward as you're trying to do that. Like that's not going to do either.
Good posture while you're doing it.
Right. So we have to watch a few cues whenever we're doing that as well.
I like doing this from the mirror to make sure that I'm doing it right.
Oh, for sure.
So I'll have my side view of it, and then I'm going to feel it back and down. I'm going to make sure that my head's back over my shoulders to keep that, make sure I'm in a good position with it. And I'll definitely check the forward one to make sure that my shoulders are down too, so I don't see them raised up in that area. You're going to feel a ton of burn, between your shoulder blades if you're doing it right.
Yeah, and you should probably be feeling it the next day if done right.
Same thing with this one. So these are muscles of holding. So a minute to 2 minutes is what you're looking to be able to hold this against resistance. You definitely don't go crazy and get like a 40-pound band or anything like that.
Oh, no.
The biggest guys I've had in here still can't do a 20-pounder for 20 minutes without screaming and hollering the whole time.
Yeah, no.
Definitely don't go too crazy with it. A couple times a week is where I would go with these. So I wouldn't do it every day. But at least if you wanted to go on the high end, every other day is where you can go with it. If you do this consistently for a period of time, it's going to take a minute. It's not something that's going to happen right away. It's not going to make a big difference in the first week. 30 days, 60 days, 90 days, you should start to see some improvements in these muscles, the way that they work, the tightness in those other muscles. Generally, a muscle change is going to happen over 90 days. So don't expect a miracle in the first couple of weeks. Maybe a little release of tension. So sometimes a lot of our patients will say, "Ooh, I'm already feeling a little bit better."
Yeah, exactly.
20% better. I'm feeling some improvement. Visually on the outside, testing wise, we're not going to see huge changes, but we're going to see those little micro progressions towards our goal. So those are some of the exercises that help us with the upper cross syndrome. Those are some of the symptoms and all the parts and pieces in between. If you have some questions about upper cross syndrome or anything else, you can always message us through here. We're on all the social medias, Facebook, Twitter, all those things. You can message us through that. Of course, you can come to the office. Right now we have new patient specials. So if you wanted to check us out on our website, texasfhc.com,
Yep.
you can book yourself for one of those appointments so we can go through all the fun things that could possibly be wrong with you and how to go about fixing it. Until next week, we'll see you next time.
See you.